ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਵਰਲਡ ਨਿਊਜ਼ ਦੇਖ ਰਹੇ ਸਾਰੇ ਦਰਸ਼ਕਾਂ ਦਾ ਮੈਂ ਰਾਜਵਿੰਦਰ ਕੌਰ ਸਵਾਗਤ ਕਰਦੀ ਹਾਂ। ਖਬਰਾਂ ਦੀ ਸ਼ੁਰੂਆਤ ਤੋਂ ਪਹਿਲਾਂ ਇੱਕ ਨਜ਼ਰ ਮਾਰ ਲੈਂਦੇ ਹਾਂ ਸੁਰਖੀਆਂ ਦੇ ਵੱਲ। ओंटारियो ਦੇ ਚੀਫ ਮੈਡੀਕਲ ਅਫਸਰ ਨੇ ਕੋਵਿਡ ਟੈਸਟਿੰਗ ਤੇ ਆਈਸੋਲੇਸ਼ਨ 'ਚ ਕੀਤੀ ਤਬਦੀਲੀ। ਨੋਵਾ ਸਕੋਸ਼ੀਆ ਸਰਕਾਰ ਨੇ ਬੂਸਟਰ ਖੁਰਾਕਾਂ 'ਚ ਕੀਤਾ ਵਾਧਾ। ਕੈਨੇਡਾ 'ਚ ਪੰਜਾਬੀ ਵਿਦਿਆਰਥੀ ਦੀ ਹੋਈ ਮੌਤ। ਅਤੇ ਹੁਣ ਖਬਰਾਂ ਵਿਸਥਾਰ ਦੇ ਨਾਲ। ओंटारियो ਦੇ ਚੀਫ ਮੈਡੀਕਲ ਅਫਸਰ ਡਾਕਟਰ ਕਿਰਨ ਮੂਰ ਨੇ ਪ੍ਰੋਵਿੰਸ ਅੰਦਰ ਕੋਵਿਡ-19 ਟੈਸਟਿੰਗ ਅਤੇ ਆਈਸੋਲੇਸ਼ਨ ਦਿਸ਼ਾ ਨਿਰਦੇਸ਼ਾਂ ਵਿੱਚ ਤਬਦੀਲੀਆਂ ਦੀ ਘੋਸ਼ਣਾ ਕੀਤੀ ਹੈ। ਉਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ 31 ਦਸੰਬਰ ਤੋਂ ਜਨਤਕ ਤੌਰ ਤੇ ਫੰਡ ਪ੍ਰਾਪਤ ਪੀਸੀਆਰ ਟੈਸਟ ਸਿਰਫ ਉੱਚ जोखिम ਵਾਲੇ ਵਿਅਕਤੀਆਂ ਲਈ ਉਪਲਬਧ ਹੋਣਗੇ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਉਹਨਾਂ ਵੱਲੋਂ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਗਈ ਕਿ ਸੂਬਾ ਸਰਕਾਰ ਵੱਲੋਂ ਆਈਸੋਲੇਸ਼ਨ ਮਿਆਦ 10 ਦਿਨਾਂ ਤੋਂ ਘਟਾ ਕੇ 5 ਦਿਨ ਕਰ ਦਿੱਤੀ ਗਈ।
Today, we are reporting 13,807 new cases of COVID-19 in Ontario. I know that this number and the numbers that we have seen in the last few days feel overwhelmingly high. But with a doubling time of approximately 3 days, we must be prepared to see our cases continue to grow. The good news is that with this increase in cases, we have not seen a corresponding rapid increase in hospitalizations and ICU admissions. Today, we are reporting 965 people in hospital and 200 people in ICU due to COVID-related critical illness. This is thanks to the effectiveness of the vaccines and the willingness of Ontarians to embrace vaccination and prevention. It is also because Omicron is different from other variants. While it is clear it is more transmissible, preliminary findings from Public Health Ontario suggest Omicron is the first dominant variant to demonstrate a decline in disease severity. The risk of hospitalization or death was 54% lower for Omicron cases as compared to Delta cases. While this is good news, because Omicron is much more transmissible, it is expected that the number of hospitalizations and impacts on the healthcare system will be significant. December 31st, publicly funded PCR testing will only be available for those vulnerable individuals, including those with significant medical issues who are symptomatic or at risk of severe disease from COVID-19, including for the purposes of confirming a COVID diagnosis prior to beginning treatments, and workers, residents, and others in the highest risk settings, such as hospitals, long-term care, retirement homes, and congregate living settings. In addition, most individuals with a positive result from a rapid antigen test will no longer be required or encouraged to get a confirmatory PCR or rapid molecular test. And there will be no testing for asymptomatic individuals in the community. Ontario is also changing the required isolation period based on growing evidence that generally healthy people with COVID-19 are most infectious for the 2 days before their symptoms develop and for 3 days after their symptoms. Individuals who are vaccinated, as well as children under 12, will be required to isolate for 5 days from following the onset of symptoms. This also applies to their immediate household contacts. The isolation can end after 5 days if symptoms are resolved or improving for at least 24 hours and all public health and safety measures such as masking and physical distancing are followed.
ਨੋਵਾ ਸਕੋਸ਼ੀਆ ਸਰਕਾਰ ਵੱਲੋਂ ਘੋਸ਼ਣਾ ਕੀਤੀ ਗਈ ਹੈ ਕਿ 3 ਜਨਵਰੀ ਤੋਂ ਸੂਬਾ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਬੂਸਟਰ ਖੁਰਾਕਾਂ ਲਈ ਯੋਗਤਾ ਨੂੰ ਵਧਾ ਰਹੀ ਹੈ। ਨੋਵਾ ਸਕੋਸ਼ੀਆ ਦੇ ਪ੍ਰੀਮੀਅਰ ਟਿਮ ਹਿਊਸਟਨ ਨੇ ਇੱਕ ਵਰਚੁਅਲ ਨਿਊਜ਼ ਕਾਨਫਰੰਸ ਵਿੱਚ ਦੱਸਿਆ ਕਿ 3 ਜਨਵਰੀ ਤੋਂ 30 ਸਾਲ ਅਤੇ ਇਸ ਤੋਂ ਵੱਧ ਉਮਰ ਦੇ ਲੋਕ ਬੂਸਟਰ
weeks, we've reported almost 7,600 cases, 7,594 cases over the last 2 weeks. But thankfully, like other jurisdictions, we're not experiencing the level of hospitalization and severe illness with Omicron that we've seen with previous variants. The public health team is watching the hospitalizations very closely, as those 25 patients in hospital and 3 in the ICU are key indicators. When you think of the number of cases and add in their close contacts, tens of thousands of Nova Scotians have been impacted by the virus over just the last few weeks. This has put pressure on so many organizations, and you only need to look at the situation with the airlines to see the wrinkle effect of isolation and illness. Our healthcare professionals in the healthcare system are no different. This is a massive challenge in a system that is already severely understaffed. Our people are stretched thin. They're giving it their all. They're going above and beyond. So now we, as Nova Scotians, must match their determination and do our part so that they can do their job. This means some changes. No one likes change, but the world has changed since the beginning of the pandemic. The variants have changed. The vaccinations have been a game changer. And now we must also accept the reality in front of us. And that means change. First, it means that each of us has to take more personal responsibility. With stretched resources, we must ask Nova Scotians to take more personal responsibility. It's just that simple. I know everyone is eager to get their booster shot, but on boosters, we're sticking with the NACI recommendation that the booster is most effective 6 months after your second dose. We're sticking with NACI on that. I told you before Christmas that we needed a supply of boosters and kind of laid out where we were. I want to thank the federal government for coming through with the supplies we need. We reached out to the federal government. We made an ask. There's been a number of discussions. They've been extremely accommodating. They're coming through with shipments arriving during the month of January. We expect to have the supply we need. This is incredible. And I can't express how appreciative we are to Minister Duclos, Minister LeBlanc, and the Prime Minister directly for their support. We've had a lot of support through the system, including our local MPs. So I thank them for that. But let's talk about where we are as of today, knowing the supply situation. So with the supply now available, we will open up a couple 100,000 new appointments on Monday. We feel the urgency, and the team is working hard to add even more appointments. But to add more appointments, we have to overcome two remaining challenges. First, we need more people. We need people to help actually get those vaccines in arms. This is our biggest hurdle, especially now that we have an extreme shortage and pressure of healthcare workers and on the healthcare.
क्यूबिक सूबे अंदर लगातार वध रहे ओमिक्रॉन वेरिएंट के केसां कारण अज सूबा सरकार वालों सख्त पाबंदियां का ऐलान किया गया। क्यूबिक के प्रीमियर ने घोषणा की है कि सूबे अंदर रात 10 बजे तो सवेरे 5 बजे तक का नाइट कर्फ्यू दोबारा लगाया जाएगा। लगाईयां जा रही होर पाबंदियां विच डिलीवरी ते टेक आउट नूं छड्ड के सारे रेस्टोरेंटां नूं बंद करना भी शामिल है। जिक्रयोग है कि प्रोविंस ने वीरवार नूं रिकॉर्ड तोड़ 14,188 नवे केस रिपोर्ट किए ने।
Experts tell us that there's a risk that we won't be able to treat all those who need it in the coming weeks. I know we're all tired, but it's my responsibility to protect ourselves from this. This is why I'm announcing new restrictions starting tomorrow. Restaurants will have to close except for deliveries and takeout. Private gatherings in homes will now be prohibited except for caregivers and for people living alone. I'm also announcing a curfew from 10 p.m. to 5 a.m. starting tomorrow night. Unfortunately, all indoor sports will have to stop. Places of worship will have to close except for funerals limited to 25 people, and teleworking remains mandatory. School, CEGEP, and universities will remain closed until January the 17th. Regular daycare will remain open, and school daycare services will remain open, but only for essential workers. I also have a message for the people who work in our health system. More than ever, Quebec needs you to provide health care to those who need it. We ask everyone who can to come and help your colleagues. We also have a shortage of employees in stores, including essential ones. This is why we've also decided to close stores for the next 3 Sundays. This will help shops that are short of employees. I also ask everyone to get their 3rd dose of vaccine as soon as possible. That makes all the difference. I know the restrictions are difficult. I know there's a lot of anxiety. If you're not feeling well, it's important to ask for help. We have to take care of each other, but I still want to wish all Quebecers health and happier news for 2022. Thank you.
ਸਸਕੇਚੁਅਨ ਦੇ ਪ੍ਰੀਮੀਅਰ ਸਕਾਟ ਮੋ ਅਤੇ ਸੂਬਾਈ ਸਿਹਤ ਮੰਤਰੀ ਪਾਲ ਮੈਰੀਮੈਨ ਨੇ ਸੂਬੇ ਅੰਦਰ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਦੇ ਵਧਦੇ ਹੋਏ ਪ੍ਰਸਾਰ ਨੂੰ ਵੇਖਦੇ ਹੋਏ ਸੂਬੇ ਦੇ ਸੋਧੇ ਹੋਏ ਕੋਵਿਡ-19 ਕੇਸ ਪ੍ਰਬੰਧਨ ਤੇ ਟੈਸਟਿੰਗ ਗਾਈਡਲਾਈਨਸ ਦੀ ਘੋਸ਼ਣਾ ਕੀਤੀ ਹੈ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਰੈਪਿਡ ਐਂਟੀਜਨ ਟੈਸਟਿੰਗ ਕਿੱਟਾਂ ਹੁਣ ਪੂਰੇ ਸੂਬੇ ਵਿੱਚ ਉਪਲਬਧ ਨੇ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਜੇਕਰ ਕਿਸੇ ਨੂੰ ਕੋਵਿਡ-19 ਦੇ ਲੱਛਣ ਮਹਿਸੂਸ ਹੁੰਦੇ ਨੇ ਤਾਂ ਉਹ ਤੁਰੰਤ ਆਪਣੇ ਆਪ ਨੂੰ ਸੈਲਫ ਆਈਸੋਲੇਟ ਕਰ ਲਵੇ।
It is more resistant to vaccines, at least in terms of how it transmits between people. But being vaccinated most certainly does keep you from becoming seriously ill or sick. In particular, if you've went out and gotten your booster shot, which is available for the vast majority of Saskatchewan residents today. We are seeing these very differences in our everyday case numbers. Yes, the number of cases in Saskatchewan is rising and will continue to rise, but hospitalizations and ICU admissions continue to fall. In fact, they're at their lowest levels since back in August. In the past 2 weeks, for example, the 7-day average of our new cases in Saskatchewan has increased by nearly 4 times in just 2 weeks. During that same time period, hospitalizations have decreased by 21%. And the number of patients that are in our intensive care units due to COVID-19 is now 15, which is down 55%, again, just in the last 2 weeks. You should also, while you're out, pick up some rapid tests. As I said a week ago, you should have those tests at your home, and you should test yourself from time to time. If you're feeling a little unwell, for instance, you should run a test. If you're going out to see or be with a group of people, you should test yourself before you do so. This is very much a large part of our offensive strategy as we look ahead through the next number of weeks and months. Saskatchewan is also one of the leaders in the country when it comes to the distribution of these rapid tests, and Marlo might speak more to that in some of the questions here today. The test kits are widely available in many locations, many locations across the province. So again, if you haven't done so already, go out and pick up a rapid test kit. Have those 5 or 6 tests available in your home for you and your family. We're in a place now in Saskatchewan where we really have unprecedented testing capacity. We have our public PCR tests that are available that we've had since the beginning. Those are available for people that are symptomatic. We have our private, both PCR and rapid testing capacity that is available across this province. Many are utilizing that for proof of negative tests that are certified, as well as if they're traveling, for instance. And now we have today 12.6 million rapid tests, self-rapid tests that are available in this province. Up until today, we've been telling you that if you test positive with a rapid test, that you should then go get a PCR test to confirm that result. And we're saying today that is no longer necessary. If you test positive, you should assume that you have COVID, and you should immediately self-isolate. The Saskatchewan Health Authority will continue to offer those PCR testing sites across the province as an option for anyone who is experiencing symptoms, and we for sure would encourage people to avail themselves to that if they do have symptoms. But as rapid tests are becoming much more commonplace.
ਪ੍ਰਿੰਸ ਐਡਵਰਡ ਆਈਲੈਂਡ ਦੇ ਪ੍ਰੀਮੀਅਰ ਡੈਨਿਸ ਕਿੰਗ ਤੇ PEI ਦੇ ਮੁੱਖ ਜਨਤਕ ਸਿਹਤ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਹੀਥਰ ਮੌਰਿਸਨ ਨੇ ਚੱਲ ਰਹੀ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਲਈ ਸੂਬੇ ਦੇ ਜਵਾਬ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ। ਡਾਕਟਰ ਮੌਰਿਸਨ ਨੇ ਦੱਸਿਆ ਕਿ ਸੂਬੇ ਅੰਦਰ 169 ਕੋਵਿਡ-19 ਦੇ ਨਵੇਂ ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ ਨੇ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਪ੍ਰੀਮੀਅਰ ਕਿੰਗ ਨੇ ਕਈ ਸਹਾਇਤਾ ਪ੍ਰੋਗਰਾਮਾਂ ਨੂੰ ਮੁੜ ਖੋਲ੍ਹਣ ਦੀ ਘੋਸ਼ਣਾ ਕੀਤੀ ਹੈ, ਜਿਸ ਵਿੱਚ ਤਾਜ਼ਾ ਸਿਹਤ ਪਾਬੰਦੀਆਂ ਦੁਆਰਾ ਪ੍ਰਭਾਵਿਤ ਕਰਮਚਾਰੀਆਂ ਲਈ $500 ਦਾ ਐਮਰਜੈਂਸੀ ਭੁਗਤਾਨ ਵੀ ਸ਼ਾਮਿਲ ਹੈ।
Just with some of that in mind, one of the impacts that we are most likely to see in the coming days and weeks may not just be in the form of hospitalizations, but in absenteeism. As more people test positive and as well as their close contacts needing to isolate to do their part to stop the spread of the virus, we're going to see some absenteeism around all parts of Prince Edward Island, and that's something we're trying to get prepared for and to be ready to address, and to assure that essential services are maintained in our province. We have activated an integrated response team made up of senior officials from CPHO, Health PEI, and other government departments to ensure that government programs and services are not disrupted over the coming weeks, days, and months. This planning includes prioritizing essential services such as programs to vulnerable islanders, ensuring payments and support programs are administered without interruption, all the while ensuring that the safety and well-being of both islanders and our public service are maintained as we continue to offer these important services. We have asked each department to renew and enact their business continuity plans in the last few days, as well as to identify staff who could be redeployed to essential service areas across government so that we can maintain these services for islanders. As well, all government employees who can are and will continue to work from home to limit the spread inside of government and beyond. At this time, no essential services have been impacted. The majority of public service is being asked to work from home, as I said, where possible, and where in-person work is required, the same measures we've had in place at the beginning of this pandemic and throughout are being asked to continue to be emphasized, that being the cohorting of staff, maintaining physical distance, and mandatory masking in workplaces and public spaces.
The pandemic and the aggressive Omicron variant is resulting in an unusual season for everyone here in PEI. While we did not plan to be dealing with a crushing Omicron wave at this time, it will mean we do transition, and deliberately so, towards our journey to living normally with COVID-19, where we do move from a pandemic to an endemic state, meaning that there will be, at some point, stable transmission of this virus. And this will be something we do step by step. As of 8 a.m. this morning, there are 169 new cases of COVID-19 to report, bringing our total active cases to 680 and 1,191 since the pandemic.
ਹਾਊਸ ਆਫ ਕਾਮਨਸ ਵਿੱਚ ਸਰਕਾਰ ਦੇ ਨੇਤਾ ਦੇ ਸੰਸਦੀ ਸਕੱਤਰ ਅਤੇ ਵਿਨੀਪੈਗ ਨਾਰਥ ਲਈ ਐਮਪੀ ਕੈਵਿਨ ਲੋਮੋਰਿਕਸ ਨੇ ਇੱਕ ਵਰਚੁਅਲ ਨਿਊਜ਼ ਕਾਨਫਰੰਸ ਕੀਤੀ, ਜਿੱਥੇ ਉਹਨਾਂ ਨੇ ਮੈਨੀਟੋਬਾ ਵਿੱਚ ਸਵੈ-ਇੱਛੁਕ ਕੋਵਿਡ-19 ਆਈਸੋਲੇਸ਼ਨ ਸਾਈਟਾਂ ਲਈ ਸੰਘੀ ਸਹਾਇਤਾ ਵਿੱਚ 8:4 ਮਿਲੀਅਨ ਡਾਲਰ ਦੀ ਘੋਸ਼ਣਾ ਕੀਤੀ ਹੈ, ਜਿਸ ਦੌਰਾਨ ਉਹਨਾਂ ਨਾਲ ਸੂਬੇ ਦੀ ਸਿਹਤ ਤੇ ਸੀਨੀਅਰ ਕੇਅਰ ਮੰਤਰੀ ਆਡਰੀ ਗਾਰਡਨ ਵੀ ਹਾਜ਼ਰ ਸਨ।
I hope you are all enjoying a healthy and restful holiday season. Staying apart from friends and loved ones is never easy, especially during the holidays. But at this time, it's essential that we all help prevent the spread of COVID-19. Having said that, I think it's important to acknowledge that for some Canadians, physical distancing is not that simple. Studies show that individuals from lower income, densely populated neighborhoods are disproportionately affected by the virus. Crowded housing conditions and restrictive costs can make it unsafe or even impossible to self-isolate, which increases the risk of community transmission. The Government of Canada remains focused on protecting the health and safety of Canadians and reducing the spread of COVID-19. As part of our growing list of rapid response tools, the government is providing over $100 million for municipalities to establish voluntary isolation sites under the Safe Voluntary Isolation Sites Program, or SVISP. This program helps address the needs of the most vulnerable populations during the pandemic. Today, on behalf of the Honorable Jean-Yves Duclos, Minister of Health, I am pleased to announce that through the SVISP, the Government of Canada is providing $8.4 million in funding for the province of Manitoba. This funding will support the expansion and creation of safe voluntary isolation sites across the province. including sites in Winnipeg, Brandon, The Paw, and Thompson. We know that COVID-19 spreads easily within households. Safe voluntary isolation sites can help limit the spread of the virus and keep residents in our communities safer. Now, before I finish, I just want to remind everyone to continue following the layers of public health precautions to prevent the further spread of COVID-19. We all have to adhere to these guidelines to keep caseloads manageable. Getting fully vaccinated, wearing a well-fitted mask, hand washing, physical distancing, self-isolating if required. We must join with everyone in our communities to make a practical contribution. I personally believe that there's reason to have hope as politicians of all political stripes, different levels of government have come together to make a difference.
ओमिक्रॉन वेरिएंट कोविड-19 ਦੇ ਬਾਕੀ ਕਿਸਮਾਂ ਦੇ ਮੁਕਾਬਲੇ ਜ਼ਿਆਦਾ ਤੇਜ਼ੀ ਨਾਲ ਫੈਲਦਾ ਹੈ ਤੇ ਉੱਥੇ ਹੀ ਇਸ ਤੋਂ ਬਚਾਅ ਦੇ ਲਈ ਵਧੇਰੇ ਸੁਚੇਤ ਰਹਿਣ ਤੇ ਸਾਵਧਾਨੀਆਂ ਵਰਤਣ ਦੀ ਵੀ ਜ਼ਰੂਰਤ ਹੈ। ਡਾਕਟਰਾਂ ਦੇ ਅਨੁਸਾਰ ਜੇਕਰ ਤੁਸੀਂ ਇਸ ਵੇਰੀਐਂਟ ਦੀ ਲਪੇਟ ਵਿੱਚ ਆ ਜਾਂਦੇ ਹੋ ਤਾਂ ਸ਼ੁਰੂਆਤੀ ਲੱਛਣ ਦਿਖਣ ਤੇ ਘਰ ਵਿੱਚ ਇਕਾਂਤਵਾਸ ਦੌਰਾਨ ਕੁਝ ਉਪਾਅ ਵਰਤ ਕੇ
Stay hydrated, so पानी पीना पड़ेगा, okay? You can mix it in with apple juice, water, ginger ale water, right? Half and half. A little bit of sugar keeps you a little bit energized, but being hydrated is very important. Tylenol, Advil, these medications will help control your fever. They'll help with the muscle aches that people get with COVID. And if you're feeling a little bit less achy, less tired, then you're going to be able to drink and take care of yourself the way you should. If you're living in a house with other people or an apartment with other people, you have to make sure that anything Jovi shared surface hagia, right? Doorknobs, sinks, any dishes, all of that has to be wiped, right? All of that has to be cleaned. You see, Lysol wipes, yeah, you can use a bleach solution, spray it, wipe it. Everything has to be wiped down. Vaccine the purpose nahi si ke infect nahi hona. Okay, it's not going to prevent infection. The purpose of the vaccines are to prevent death, prevent severe illness. You don't get so sick that you have to see me. That's the purpose of the vaccine. Okay, and the vaccines are doing an excellent job so far of preventing people from dying. People who have had 2-shot series, had their third shot. It's doing an excellent job of keeping these people out of hospital. Death rate is so low. What's the big deal? You know, less than 1%, less than 0.5% of people die. This is ISOCHO. When we have somebody in the ICU and we have to cut off their leg and cut off their arm, and they survive COVID and they go home, what category do they go into? That's a COVID survivor. Is that the quality of life you want when you survive an illness? No, don't take the chances. Karo, use your mask, hatato, get vaccinated. Please, tika lagao. Bahut important gal hai ye. Report kite si ki, you know, 10,000, 10,000 log hai COVID positive. Could be 20,000. The real number could be 30,000. We don't know. We don't know. But it's going to keep going up and up and up for the next little while. Probably within the next 2 to 3 weeks, it's going to peak. And then it's going to quickly come down.
ਪੰਜਾਬੀਆਂ ਦੀ ਸੰਘਣੀ ਆਬਾਦੀ ਵਾਲੇ ਕੈਨੇਡਾ ਦੇ ਸ਼ਹਿਰ ਸਰੀ 'ਚ ਪੰਜਾਬ ਤੋਂ ਅੰਤਰਰਾਸ਼ਟਰੀ ਵਿਦਿਆਰਥੀ ਦੇ ਤੌਰ ਤੇ ਪੜ੍ਹਾਈ ਲਈ ਆਏ ਨੌਜਵਾਨ ਵਿਦਿਆਰਥੀ ਅਮਰਜੀਤ ਸਿੰਘ ਪੁੱਤਰ ਸੁਖਦੇਵ ਸਿੰਘ ਦੀ ਬੀਤੇ ਦਿਨੀ ਮੌਤ ਹੋਣ ਦੀ ਮੰਦਭਾਗੀ ਖਬਰ ਸਾਹਮਣੇ ਆਈ ਹੈ। ਨੌਜਵਾਨ 4 ਕੁ ਸਾਲ ਪਹਿਲਾਂ ਕੈਨੇਡਾ ਵਿਖੇ ਪੜ੍ਹਾਈ ਕਰਨ ਲਈ ਆਇਆ ਸੀ। ਦੱਸਿਆ ਜਾ ਰਿਹਾ ਹੈ ਕਿ ਜਨਵਰੀ 2022 'ਚ ਉਸ ਨੂੰ ਕੈਨੇਡਾ ਦੀ PR ਮਿਲਣੀ ਸੀ। ਮ੍ਰਿਤਕ ਮਾਪਿਆਂ ਦਾ ਇਕਲੌਤਾ ਪੁੱਤਰ ਤੇ ਇੱਕ ਭੈਣ ਦਾ ਭਰਾ ਸੀ। ਉਸ ਦੀ ਮੌਤ ਦਾ ਕਾਰਨ ਦਿਲ ਦਾ ਦੌਰਾ ਪੈਣਾ ਦੱਸਿਆ ਜਾ ਰਿਹਾ ਹੈ। ਨੌਜਵਾਨ ਦਾ ਪੰਜਾਬ ਤੋਂ ਪਿਛੋਕੜ ਪਿੰਡ ਸੂਰਕੋਰੀ ਜ਼ਿਲ੍ਹਾ ਫਰੀਦਕੋਟ ਸੀ। ਮ੍ਰਿਤਕ ਨੌਜਵਾਨ ਦੇ ਪਰਿਵਾਰ ਨੇ ਕੈਨੇਡਾ ਸਰਕਾਰ ਤੋਂ ਮੰਗ ਕੀਤੀ ਕਿ ਉਹਨਾਂ ਦੇ ਨੌਜਵਾਨ ਪੁੱਤ ਦੀ ਮ੍ਰਿਤਕ ਦੇਹ ਭਾਰਤ ਵਿੱਚ ਲਿਆਉਣ 'ਚ ਉਹਨਾਂ ਦੀ ਮਦਦ ਕੀਤੀ ਜਾਵੇ ਤਾਂ ਜੋ ਉਸਦਾ ਅੰਤਿਮ ਸੰਸਕਾਰ ਉਸ ਦੀ ਜਨਮ ਭੂਮੀ ਪਿੰਡ ਸੂਰਕੋਰੀ ਵਿਖੇ ਕੀਤਾ ਜਾ ਸਕੇ। ਚੀਨ ਆਪਣੀਆਂ ਚਾਲਬਾਜ਼ੀਆਂ ਤੋਂ ਸੁਧਰਨ ਨੂੰ ਤਿਆਰ ਨਹੀਂ ਹੈ। ਇਸ ਲਈ ਉਹ ਭਾਰਤ ਦੇ ਪਲਟਵਾਰ ਤੇ ਗਿੱਦੜ ਭਵਕੀ ਦੇਣ ਤੋਂ ਬਾਜ਼ ਨਹੀਂ ਆ ਰਿਹਾ। ਚੀਨ ਨੇ ਅਰੁਣਾਚਲ ਪ੍ਰਦੇਸ਼ ਦੇ 15 ਹੋਰ ਸਥਾਨਾਂ ਦੇ ਨਾਮਕਰਨ ਦਾ ਬਚਾਅ ਕਰਦੇ ਹੋਏ ਦਾਅਵਾ ਕੀਤਾ ਹੈ ਕਿ ਤਿੱਬਤ ਦਾ ਦੱਖਣੀ ਹਿੱਸਾ ਪ੍ਰਾਚੀਨ ਕਾਲ ਤੋਂ ਚੀਨੀ ਖੇਤਰ ਦਾ ਹਿੱਸਾ ਰਿਹਾ। ਉੱਥੇ ਹੀ ਭਾਰਤ ਨੇ ਅਰੁਣਾਚਲ ਪ੍ਰਦੇਸ਼ ਦੇ 15 ਸਥਾਨਾਂ ਦੇ ਨਾਮ ਬਦਲਣ ਦੇ ਚੀਨ ਦੇ ਕਦਮ ਤੇ ਸਖਤ ਇਤਰਾਜ਼ ਜਤਾਉਂਦੇ ਹੋਏ ਕਿਹਾ ਕਿ ਰਾਜ ਹਮੇਸ਼ਾ ਭਾਰਤ ਦਾ ਅਨਿੱਖੜ ਵਾਂਗ ਰਿਹਾ ਹੈ ਤੇ ਰਹੇਗਾ, ਕਿਉਂਕਿ ਮਨਘੜਤ ਨਾਵਾਂ ਨਾਲ ਸੱਚਾਈ ਨਹੀਂ ਬਦਲਦੀ। ਸਾਊਦੀ ਅਰਬ ਦੀ ਅਗਵਾਈ ਵਾਲੀ ਗੱਠਜੋੜ ਫੌਜ ਨੇ ਗਲਤੀ ਨਾਲ ਸਹਿਯੋਗੀ ਯਮਨ ਸਰਕਾਰ ਸਮਰਥਕ ਸੁਰੱਖਿਆ ਬਲਾਂ ਦੇ ਇੱਕ ਕੈਂਪ ਤੇ ਹਵਾਈ ਹਮਲਾ ਕਰ ਦਿੱਤਾ ਹੈ, ਜਿਸ 'ਚ ਘੱਟੋ-ਘੱਟ 12 ਫੌਜੀਆਂ ਦੀ ਮੌਤ ਹੋ ਗਈ। ਯਮਨ ਦੀ ਫੌਜ ਦੇ ਅਧਿਕਾਰੀਆਂ ਨੇ ਇਹ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ। ਅਧਿਕਾਰੀਆਂ ਨੇ ਪਛਾਣ ਗੁਪਤ ਰੱਖੇ ਜਾਣ ਦੀ ਸ਼ਰਤ ਤੇ ਦੱਸਿਆ ਕਿ ਹਵਾਈ ਹਮਲੇ ਸ਼ਾਹਵਾ ਸੂਬੇ ਵਿੱਚ ਕੀਤੇ ਗਏ, ਜਿਸ 'ਚ ਘੱਟੋ-ਘੱਟ 8 ਫੌਜੀ ਜ਼ਖਮੀ ਵੀ ਹੋਏ ਨੇ। ਸਾਊਦੀ ਅਰਬ ਦੀ ਅਗਵਾਈ ਵਾਲੀ ਗੱਠਜੋੜ ਫੌਜ ਨੇ ਇਸ ਸਬੰਧ ਵਿੱਚ ਹੁਣ ਤੱਕ ਕੋਈ ਟਿੱਪਣੀ ਨਹੀਂ ਕੀਤੀ ਹੈ ਤੇ ਇਹ ਗੱਠਜੋੜ ਫੌਜ ਯਮਨ ਦੀ ਅੰਤਰਰਾਸ਼ਟਰੀ ਮਾਨਤਾ ਪ੍ਰਾਪਤ ਸਰਕਾਰ ਦਾ ਸਮਰਥਨ ਕਰਦੀ ਹੈ। ਜ਼ਿਕਰਯੋਗ ਹੈ ਕਿ ਯਮਨ 2014 ਤੋਂ ਹੀ ਗ੍ਰਹਿ ਯੁੱਧ ਦੇ ਹਾਲਾਤ ਦਾ ਸਾਹਮਣਾ ਕਰ ਰਿਹਾ ਹੈ, ਜਦੋਂ ਈਰਾਨ ਦੇ ਸਮਰਥਨ ਵਾਲੇ ਹੈਤੀ ਵਿਦਰੋਹੀਆਂ ਨੇ ਰਾਜਧਾਨੀ ਸਨਾ ਸਮੇਤ ਦੇਸ਼ ਦੇ ਕਈ ਹੋਰ ਸ਼ਹਿਰਾਂ ਤੇ ਕਬਜ਼ਾ ਕਰ ਲਿਆ। ਫਿਲਹਾਲ ਵਰਲਡ ਨਿਊਜ਼ ਵਿੱਚ ਬਸ ਇੰਨਾ ਹੀ। ਮੈਨੂੰ ਦਿਓ ਇਜਾਜ਼ਤ। ਧੰਨਵਾਦ।